This video is going to talk about what we do when we send a patient over for a root canal, so say an endodontic specialist to a root canal specialist, and they have to drill through a patient's crown, and then they're going to have the patient come back to us to then fix the crown or to fill in the access hole. So let's kind of walk through quickly how that process would work. Say a person has an existing crown. So here you can see the crown. And then there might be a previous buildup material. It could be silver, it could be white, it could be anything. And then they may have had a previously done root canal that has failed or has become reinfected. And so the root canal specialist has to go in and clean this all out to clean out the infection. Or maybe it was not previously root canal. Maybe the tooth had an infection just from its normal, course of having a pulp go bad, and that can happen too. So this doesn't have to be an old root canal; it could be a fresh root canal, procedure that's going to happen. Either way, there's a problem with the tooth. There's some infection that needs to be cleaned out, but the tooth already has a crown on it. So, like I said, the root canal specialist will go through the top of this crown, which we'll see right here. You can see kind of this opening right through the middle of the crown. They'll then go in and they'll do the root canal process. They'll clean it out. They'll cleanse it. They'll make sure the infection's gone. And then they're going to put in a new root canal filling material. And then they usually at that point stop and put some kind of temporary plug in this tooth. They then send the patient over to us at some point when they have released the patient saying, okay, looks like the tooth looks good. It's ready to be restored. And they'll send the patient back to us. We'll go in and just take out that temporary plug, and then we'll put our final filling in place. And so now the patient gets to keep the tooth and they get to keep the crown. Okay. But let's take a look at what that might look like clinically. Here's a couple different examples of different access holes. You can tell this one's very small, much easier to repair when the hole is small. And you can see some of these are bigger. This is actually a gold, looks like actually an onlay on this tooth. I can still see enamel there and there, but you can still hold on to this onlay and place a filler in there. And actually, if it's going to be gold, we typically would place amalgam because that would probably seal better, against the walls of that. I say seal with quotes because it's not actually sealing, but it has probably the best fit against there because it's hard to make composite actually bond to metal. It is possible, but it's a very weak bond. Anyhow, but it is possible to bond porcelain to composite, which is composite resin, what we use for fillings. Now, when a filling is put in, it can look like this. You can tell if the access hole is small, we can put something in. And here's a larger one, and still that looks good. Looks like it blends. But they can look bad as well. There's clearly, you can see there's something not quite right with this crown. The main difference between this one and this one is that this is an all porcelain crown. There's no metal at all. Whereas this one has got a metal substructure, then porcelain baked over the top of it. And so when you're trying to take composite and you're trying to make this work, you've got metal that's casting basically a shadow across the entire tooth. So it's very hard to blend, at least cosmetically, a filling into a metal-based crown, which is what this one is. There's things we can put in blockers. We can use a really white opaque composite filling. But even then, it just never really quite looks right. Always is going to have this grayish hue to it. I mean, this is very blatantly gray, but even if we put in the whitest composite we make, it's still going to have a grayish tint to it. And so the patient has a choice. I mean, they can either, if they don't like that, then they have to get a whole new crown, which is possible, or they just have to realize that's the compromise they have to make, and keeping their old crown, but then doing a filling afterwards. So this is kind of basically how that process works. Again, the endodontist goes through the crown, does the root canal, they come back to us, we then put a final filling in place. Oh, and one side note, when they come back to get this filling put in, after this temporary has been taken out and a final one goes in, since the tooth has already been root canaled, there's no need to get the patient numb. So we just take out the old plug and put in a new one, basically. So that's the endodontic access and how we fill them. Thanks.